Malachi, a few hours after he was born, we knew a little bit about him because he had a prenatal diagnosis. He was a twin.
I had known something was wrong at 34 weeks. They took me to LDS hospital and they did a special ultrasound, and that's when it was discovered that he had hydrocephalus. They did not know the severity of it until he was born. Then he would go and see Dr. Cameron up at Primary Children's, and they decided at 7 weeks that the pressure had gotten too severe, so they took him into surgery.
The traditional treatment is shunting, which is just placing a ventricular catheter into the brain, goes under the skin, has a one-way valve, so fluid can only flow out of the head, and then it runs under the skin into the belly. There's another treatment though called ETV, endoscopic third ventriculostomy, which is where we go into your brain with a camera, and the fluid inside the brain is crystal clear, so we can drive a camera through there from the lateral ventricle into the third ventricle and make a hole at the bottom. And then that is a natural shunt, which is another name for a bypass. There's now about 9 of us across Canada and the US that do this technique, and Malachi was one of my first.
The staff and doctors at Primary Children's are miracle workers. They are very compassionate, understanding about everybody's situation.
In the old days, we'd do large craniotomies or big holes in the skull to go in to access the brain, and our holes, our access points are getting smaller and smaller. There's more things that we're treating medically that we used to treat surgically. That's the whole trend of medicine, not just surgery, but specifically neurosurgery and specifically pediatrics.
When it comes to the decision I made to have the new procedure, my prayers were answered. Malachi is on track. He's right up there with his brother. He's not showing any signs of disability. He's developing right on track.